Do you have a neck that feels heavier than it used to? A brow that has dropped so low you look tired even when you're not, or cheeks that seem to have just shifted south? Today, we're talking about all three with one of Manhattan's most respected facial plastic surgeons. And we're following a question that is reshaping surgery right now: traditional approaches versus endoscopic, where a camera guides surgery from inside the body. Which is better? And is it better for every area of the face? Stay with us all the way to the end because Dr. Sterry is going to be honest about one type of facial surgery that most surgeons will not say out loud. And it's the kind of honesty that protects you. Dr. Sterry, tell me about a neck that really stayed with you, a patient whose neck told you something important about what is actually possible.
The first one that comes to mind, and there are several, but I think the first one was actually a very young patient. She was 25 years old. And she had sort of a full neck. And she told me that she'd had it as long as she can remember. It didn't matter what her weight was. And she told me that most of the women in her family had a similar neck with just a bad cervical mental angle, meaning her neck seemed to hang very full. Uh, and she came in asking for some chin liposuction. And I pretty quickly explained, I don't think that's going to cut it here. We need to sort of change your architecture in order to give you the result you want. What she wanted was a nicer profile. So we did what we call a midi neck lift. You'll sometimes see it described as a deep neck lift. But essentially, there's a 1 inch incision behind the chin crease here. And we go underneath the muscle that's immediately behind the skin, and there's a sort of a significant triangular, sometimes diamond-shaped fat pad underneath there. And I removed that. In her case, it was quite generous. And then I tightened a couple of different layers of muscle, and I actually reduced some of the muscle in the area because it was sort of bulky. And in her case, I also reduced some significantly large salivary glands that are located right about here. And the combination of those maneuvers gave her a much nicer profile, a much nicer angle, and she walked away looking like she was 25 instead of 45. She was very happy and grateful, and she let us use her photographs and Instagram and things like that. Um, and she really stuck with me because she thought, she was afraid she was doomed for the rest of her life to have this appearance. And she was actually a pretty fit young woman. There was no reason for her to live that way. She has a lot more confidence now. She feels much better about herself. And apparently she gets a lot more attention. She tells me she can't buy herself a drink at the bar anymore.
That's amazing. That's amazing that what you do can be such a confidence builder.
Yeah, it's really satisfying that way. It's a lot of fun.
I love that. I love that about being in this community. Dr. Thomas Sterry is a board certified plastic surgeon, a fellow of the American College of Surgeons, and the past president of both the New York State and New York Regional Societies of Plastic Surgeons. His practice is on Fifth Avenue in Manhattan, just across from the Guggenheim. Coming up, he's going to tell us one thing about the neck most surgeons will not discuss in a consultation. And stay with us all the way to the end because he's going to be honest about one type of facial surgery where the long-term results are still not proven. Dr. Sterry, welcome to Beauty Seek.
Thanks so much for having me. This was a lot of fun.
Most people assume the neck is one of the easier parts of the facial area to treat. On a scale of 1 to 10, how difficult is the most challenging neck to correct?
It's a 10. The neck, I personally believe that the neck is the secret to a good facelift. And there are so many different components in the neck. If you think about the moving parts to keep your head, straight and moving around, and stable, there's a lot of different parts involved, and any one of them can create problems. For instance, people who develop those neck bands, those are called platysmal bands, that is really tough to get rid of. There are some good ideas. Everybody's got a theory. I have my own. We never promise to get rid of those completely. We usually tell folks we can reduce them dramatically, but they may not go away forever. They're really tough those suckers to get rid of. The I mentioned a minute ago, reducing some of the girth of the other muscles, that's called the gastric muscle, can make a big difference. But the biggest and probably most controversial area to this day in neck surgery, cosmetic neck surgery, is the treatment of the submandibular glands, which rest right about here. And some of us are willing to tinker with them and kind of shave them down. And what we want to do is trim them back to a point where they're no longer obscuring a beautiful jawline. When we're younger, they live up behind the mandible. And as we age, they get larger and they seem to dip down a bit. So when we shave those down to a point where they're not showing, it can make a dramatic difference in the way someone looks. And this is an incredibly powerful move. And yet a lot of my colleagues aren't really willing to do that procedure.
I was speaking with Dr. White about the same thing the other day, and he was saying that some surgeons will even like inject Botox to try to shrink them. Is that a
Yes,
valid?
that's the thing. It's a little bit tricky. It's hard to find. You need to be pretty slick with your ultrasound. But that's only a temporary measure. And I kind of have a little bit of resistance to it for a few reasons, including the gland. One of the main reasons the surgeons are nervous about going near it is that it bleeds pretty profusely. And I'm not necessarily wanting to put something sharp into it if I can't touch it and feel it and control the bleeding that I might cause. So yes, those things are done. I think the odds of a problem are pretty low, in fairness to Dr. White. I'd rather just do something definitive and take care of the problem. If I'm doing a neck lift anyway, and I'm looking at the gland, I'm going to reduce it, most likely.
Okay. It sounds like a scary thing, but yes, in the right hands, it can be a beautiful result.
Well, I think that a lot of us, unfortunately, a lot of surgeons, they rely on their training that they had years ago. And if they weren't trained to do a particular maneuver, they may never learn that skill. So you do have to be willing to go and get the cosmetic goods. You have to go to the boutique courses and anatomy labs, things like that, and learn the proper technique so that you, as a surgeon, feel safe and confident during the procedure. Short of that, I don't think that people should address it willy nilly. So the folks that aren't willing to, I understand. I don't tell anybody that they should. But what I do say is that they should learn about it and then decide whether or not they want to do the procedure. Um, when someone never was trained and doesn't know how and says that they simply won't, I think that's sort of closed-minded.
Okay. So a question that a beauty seeker could ask a surgeon if they are watching this interview and they're learning about shaving down those glands might be, have you been trained in this? How often have you done this?
Well, yeah, I think that's a probably reasonable question. I think that the one question a lot of patients really should ask the surgeon about any procedure is, how often do you do this? How many have you done? That sort of thing. Were you trained in this area? There are, I hate to say such things, but there are folks kind of practicing outside of their training. And that's a little bit bothersome, right? You'd like to know that they've been there before, that they're confident, that this is something that they do every day like bread and butter. Um, that certainly is something that patients should know about the surgeon who's about to perform their operation.
And on that vein of thought, you performed over 1,000 chin and neck liposuction procedures, more than many surgeons, I would guess. On a scale of 1 to 10, how much can liposuction alone improve the right neck?
Well, the key is that last part, the right neck. Um, when someone has a lot of subcutaneous fat in this area, it can make a tremendous difference for the right person. And yes, we've done, actually, we just counted these last week. We've now done 1,091 chin neck liposuction cases. And, I'd like to think that they're all happy. I can tell you that the vast majority of them are very happy with their outcomes. So it can make a nice improvement in the right person. That doesn't mean that it's right for everyone. Sometimes the challenge that I have as a surgeon is helping patients understand their own anatomy and why liposuction might not be the right procedure for them. And it's a little bit hard to accept sometimes. I have to sit down and really get into at a granular level the anatomy and what I'm thinking and why. Because at the end of the day, I want them to be happy. They need to walk away glad that we met. The old saying, if they don't look good, I don't look good. So it's really all about me, right? I'm just protecting myself. I just really need them to look great when we're finished.
Definitely. You protect the patient, you protect yourself. Can you give us one reason why it might not be a good procedure for the neck, liposuction?
Oh, sure. You heard me describing the anatomy a minute ago. The truth is, sometimes people don't have that much subcutaneous fat. In other words, fat right behind the skin, and yet they still seem to have a full neck. And sometimes that is fat that is deeper. It's underneath that first layer of muscle, which is called platysma. Sometimes, especially in men, I notice that their neck might have a lot of girth because they're muscular. And the way to fix that is to tighten up the muscle, or sometimes to reduce the muscle, as I mentioned before. Um, they they won't miss it. It's not the sort of thing that is a horrible sin. Everybody acknowledges that, but these things can be done, and liposuction in those patients is not only a waste of their time and resources financially, but it also can be a disservice from a cosmetic perspective because I've had, oh gosh, any number of young women, um, and middle-aged women for that matter, come in asking for chin or neck liposuction. And I'll say, look, if I suction this neck, you're going to have every reason to be angry with me because I'm going to give you old lady skin. You want to have a little bit of fat behind the skin because that's what gives the skin some life, some turgor, some pizzazz. It really is very healthy looking. If there's no fat behind there, it kind of looks creepy and it loses its liveliness.
Yeah, it just seems like there's so much education, and then at the same time, there's not enough where we come in, we beauty seekers come into professionals like you, and we think we know what we need. And then you have to talk us out of it.
Yeah, because they've done some research and that's quite right. Maybe even used AI, but they're pretty convinced that this is what's going to solve their problem. And then when they meet me, if I disagree with the AI or Google or whatever, that can be a little disconcerting, and it's hard sometimes for them to accept it. But listen. I've had God knows how many patients walk away. I didn't operate on them, and I just hope that they didn't walk into the next office with someone who was willing to do it because I felt strongly in those instances that it was a mistake. Believe me, I'd rather operate than not. I love my job, but if it's the wrong move, it's the wrong move.
Thank you. Yeah, I appreciate knowing that. I appreciate hearing that from surgeons that I interview. If I feel it's a no, I'm gonna have to say it's a no.
Yeah, that's the thing. Having been in this business for a minute, yeah, we're no is sometimes the best answer. Yeah.
Great. Let's dig into the men for just a moment here, a little bit deeper. So men who are very fit, those bodybuilders, athletes, they often have that neck, with a lot of muscular bulk rather than fat. We talked about that as we were prepping for the interview. How achievable on a scale of 1 to 10 can you get more of that chiseled jawline for that type of neck?
Yeah, so some of this depends on how they're built. Muscular is one thing. If they also have a lot of fatty tissue, because there's one thing to be powerful, but still have a high fat content, and it's another thing to be incredibly lean. In either case, we do have an answer for those guys because they do tend, in general, to be more lean, as I was saying. Um, if there's some fat, for instance, around this area is called the gonial angle, and everybody wants this to be nice, squared off, and clean. So we can still do a little bit of liposuction over there for some of these guys, but for those people who are particularly muscular, as you're saying, yeah, when we go in through that incision behind the chin crease, we dip underneath the platysmal muscle, and it's almost always that that digastric muscle. There are two of them right here, and they can be really large, especially if these are guys who are working out with weights and doing resistance training, because every time they kind of Valsalva and they really exert themselves, those muscles get tighter and they become hypertrophic. And so the way to handle that is to literally split the muscle and take 50% of it or so away sometimes. It depends, of course, on each situation. But that's the only way that they're ever going to get a nice, clean profile, because otherwise the bulk of the muscle is hanging down below the mandible. And it can be done, to get back to your question, but it takes some doing, and you need to have somebody who's been there before and is willing to make those maneuvers.
Okay. So if they're very lean, is it more achievable, or if
In
they have,
general, yeah, I would say in general, if they're more lean, it's better. Because the truth is, if they have a high, if they're very muscular but have a higher fat content, all right, so then I go ahead and do some liposuction anyway and take out some of the deep fat and we move on.
if a patient is sitting across from you for a neck consultation, what is the one question that you think is probably the most important thing that they never think to ask?
Yeah, I think I already alluded to it. I really think that one should ask, how many of these have you done? Is this a major part of your practice? How many did you do last month? That sort of thing. You really want to know that this is something that the surgeon is completely fluid with, that they're really articulate in the area, and they have done this many times, and they're not really hesitant. They're not nervous. It's another day of work. That's all.
Yeah. Okay. That's a good point. The math of it. I talked to Dr. Zachary and she said, don't just take the number, do the math. How many have you done in a month, in a week, and frequently?
Yeah.
Beauty seekers, here's what you just learned. The neck is all about structure. A younger patient can look decades older because of that structure, and structure can be addressed at any age. Let's talk about scars. What is the approach or technique that would kind of result in maybe the least visible scar?
Oh, well, without question, if it's possible and they're a good candidate, chin neck liposuction is almost scarless. I use a pinhole incision behind each earlobe and a crease behind each earlobe, which those essentially disappear. The patient will never see them. And then I make one in the chin crease here, which can leave a little freckle. A year later, if you look for it, you can find it, but you're going to have to look for it. It will not be obvious to anyone. So that's clearly the simplest, easiest, most invisible procedure to do, which is one of the reasons I've done it so many times. I mean, it's a great answer for the right person.
Perfect. I didn't know that you go in behind the ear. That's fantastic.
Yeah, so you could triangulate like so, and as I was saying, kind of accentuate the gonial angle, and also triangulation in liposuction is kind of a basic principle to help to prevent grooves and divots and dents and things like that. You kind of cross hatch all the areas that you want to treat all the way across the neck.
Dr. Sterry, can you talk about incisions and a little bit about the technique with a necklet, please?
Well, sure. So there's a couple of different ways that a necklet might be done. There's a couple of different incisions. Sometimes with a formal necklet, where we have excess skin that we want to reduce, we make an incision behind the ears and into the hairline so that we can sort of redrape the carpet and bring this tissue back. But anytime we want to do a necklet where we're getting into the deep space, we make an incision over here someplace. It's usually about an inch long. Some of us make it right behind the chin crease, as I do, because position-wise, it helps us to get into a more advantageous position. Some folks will put it into the chin crease itself. And, there's some minor debate about all of this. If you put the incision into the chin crease itself, the argument is, okay, well, they won't really have an additional scar exactly. And I get that, but it does have to be longer because you're trying to get down into the same area, and just mechanically trying to get into the deep neck space, it's a little bit more difficult. So I was trained to make the incision about a centimeter or two back behind the chin crease. And if the neck lift is done well, you end up lifting all this tissue anyway, and it becomes sort of horizontal facing the floor. It's in a great spot that is very hard to find. And that skin, that tissue usually heals like with a hairline incision. And so we don't really stress too much about it. Um, there is a mark, of course, but it's not really much worth talking about. So there are different styles, different ways to do these things. But that's the way that I make my incision.
Now, are you doing that endoscopically or not?
From the side, I sometimes will go endoscopically if I don't want to make, depending on how the patient's built. I can make an incision just behind the ear, like we have I told you to watch behind your ears, eye area, right in the crease where your ear meets your skull, and you can use the scope to get in down into the neck area here, and that can be very helpful. Yes, if the patient doesn't need skin redraping. If they need redraping, you might as well make the incision because you got to do it anyway. Um, in fact, not to change subject, but we can use that same incision with an endoscope to get into the lower half of the face proper as well.
Perfect. Love it. Beauty seekers, here's what you just learned. Neck liposuction for the right patient can produce a significant result with hardly a visible scar at all. And the submandibular gland is the thing that most surgeons, they probably will not discuss in a consultation. Dr. Sterry reduces it, and for the right patient, it can change everything. Dr. Sterry, most patients leave a neck consultation never having heard the word submandibular. You changed that for me and for the Beauty Seek community. Thank you for educating our community.
You're very welcome.
Thank you for being here, Beauty Seekers, from the bottom of our hearts. Every subscriber helps us bring surgeons like Dr. Sterry to this community. Coming up next, Dr. Sterry is going to tell us about a brow lift technique that proved itself and why the original endoscopic approach failed and what changed. Don't go away. So, okay, as you said, most patients don't even understand that a brow lift would give them the results as compared to, an upper cleft. What questions could they ask to understand if that would give them a better result?
Look, sometimes they're afraid of looking surprised for the rest of their life. They might want to ask, what happens if my brow is too high? Can you lower it? The answer is yes.